Dr. Kendra, thank you so much for joining me today. I was excited, when I was like, oh, I have the opportunity to talk to the doctor, honey. And you do so many things, not just a doctor. How has quarantine been for you? Like, I know things have probably slowed down or maybe even got more busy for you and everybody in the medical field. How has that been?
Kiki, you said it right. So just going on my personal life, I've been getting cabin fever because I've just been working a lot. And it's funny because, I hate to say it, okay, and the jury is still out, but because you're asking a question and I'm in that mindset, I'm going to tell you a secret. That I think that my husband Hobart might be right. I'm working full time, and this COVID pandemic, it's literally a war. And a lot of people think that it's a game or they think it's lies, and they're involving a pandemic to politics. They're connecting the two. And so it's sad because every day I go to work, I'm wearing that, look at this acne. Okay. I'm wearing these masks and they're tight. And I operate. So when I go into operating room, I have to double up on my mask. And so it's really tough to breathe in them. I'm sweating, and then now I'm breaking out. And so, I just want to let everybody know that this is not make-believe. This is real, so please wear a mask. So with that said, Kiki, Kikiing with you. So I'm working a lot. Like I pull like 48 hours when I'm in the hospital and I do not see the sun because my colleagues, they're getting COVID, and so I haven't been able to spend as much time with Hart as I want. He's already 1 year old in 1 month, and I don't know how mothers do it. I respect, all kinds of mothers, stay-at-home moms, working moms. And as you know, Hobart, he's a physician. He works long hours. So right now, my nanny stepped up. My mother, God bless her because, she has arthritis. She's stepping up. So said all of that, I've been working just a lot of hours. So I'm getting cabin fever because right now I've been working so hard. And normally, especially before I had Hart, type of person that I work hard and I play hard. Okay. Can you guys, does anybody understand what that means? Okay. So
you like to turn up as much as you work. Yes.
Commit to whatever I'm doing. And so that I understand when my patients tell me that they're tired of all this, I want to travel. They want to go out, I feel the same way. So I'm praying. And I'm just remembering that this is serious. And every time I get a patient, if they have COVID, or one of my colleagues, they have COVID, so they're out quarantining. I remember, Kendra, this is not a game. So just go meditate, spend time with Hart, maybe I'll get into gardening, stick to my diet, do my squats.
Right.
You know what I mean? So that's where I'm at right now.
Yeah. So I couldn't imagine. Okay. I do this radio thing and that is nothing compared to what everybody.
No. I don't like when people say that. No. We need you. Everybody needs to give their gifts away before we're called. Okay. Before we go on to the next level. So I just want you to rephrase that.
Okay. You're right. You're so right. But I just admire so much people in the medical field. I mean, from CNAs on up,
shout out to CNAs.
Yeah.
Workers. Yes. Yes, sir.
I feel like they don't get the appreciation they deserve. But, I'm just like, I couldn't even imagine. And then with you doing a TV show and dealing with, and you're still a new mom, how has your life changed since being a part of reality TV?
I was just telling one of my good friends, actually Britton, another girl on the show.
Yeah.
That I'm still adjusting to being a new mother because, it's hard. I'm out of the postpartum phase, Hart is 1 year and a month. But I think some of my anxiety, sometimes when I'm just down, I
Yeah.
realized that, you know what, I had a child later in life. So, you know, I try to explain to people, you know, they're like, oh, but you have a nanny, you have your husband, what's the problem? But I try to remind people that I had a baby later in life. I was 39 years old when I gave birth to Hart. So what does that mean? That means that I have lived my life doing me, because my husband is a grown ass man who's competent. You know what I mean? So I have to get used to modifying my life,
Yeah.
having this baby. And so the old me, I used to be like, let me get this to you by end of day. How many of us be like EOD?
Mm-hmm.
I come home and Hart is like, no, ma, I haven't
Yeah.
seen you maybe for, a day and a half. And I demand your time, and you're not going to get that done because I need you right now. And
Yeah.
so I think that I'm in the process of learning how to navigate,
Mm-hmm.
still do the things that I want to do, but kind of balancing and mixing that with being a new mother, and I'm being completely transparent. And a lot of us don't talk about it, I admit, because it seems like I'm weak or something. And I tell myself, Kendra, get your mom tribe, ask other mothers, because this is what I'm struggling with. And sometimes I feel like, Kendra, you're not, being a woman of your word, you're
Right.
delaying a lot of things. But honestly, Kiki, when I step through the door, Hart, he's something. He's
All kids, yes.
He's singing, and he wants me to watch him do those things. So I'm learning to be like, you know what, babe, I'll have that back in 2 weeks. I need
Mm,
to restructure my thinking and
yeah.
set life around him. So that is what me and Hobart are going through as new parents, but older in life. Because my mother had my sister when she was 19. So my mother grew up and she learned how to be a working mother, how
Yeah.
to with the child when she was still a child. I mean, she
Right.
was a teenager technically. So,
Mm,
because my mom, she's like, no big deal. You're weak. Buck up. Okay. If she was speaking like a black woman, she'd be like, buck up. But
right.
I said, but mommy, you learned how to be a woman with me. You
Mm-hmm.
know, you were developing as a person. So there is a difference. And I am going to pledge to you that I'm going to reach out more, to I know so many wonderful women in my life that I need to ask for help, and just, and have somebody actually talk about my feelings.
Yeah. I mean, you give just hearing you talk now, you're giving me hope because, I just turned 30. So, we are, as young women, we always have that, if we don't have this by this time, and we don't have kids by this time, and to know that you at 39, it can happen and it can be done. Yeah. So you're giving women all around the world hope, and, girl, keep going. That's all I can tell you.
Thank you.
Yeah. So now when we were getting to know you on the show, watching you, and what caught my attention, of course, was the mess. Okay. So as soon as we saw, I said, Heavenly, what did you just say? But you checked it right away. And recently I saw that you and Heavenly kind of made up and, are on good terms. But how was that experience on reality TV? Like, you're new to the show, you're new to this whole reality thing, and bam, somebody tries you right away.
I mean, I think that the world got to see part of my reaction. And I think, me being shocked, if I was wearing a pearl set, I would have clutched it, mouth open. I mean, because, looking back, one thing about reality TV is that I get to look back at how I was, how I looked, what I was
Yeah.
doing, what I was thinking. And that moment, and I want all your viewers to know that moment was real.
Mm,
Me going out, that was the very first time, Kiki, that I had went out, and that was the first time that I was away from Hart. So remember, I
okay.
had my baby. I'm trying to get the hang of breastfeeding. I was sleep deprived. Hart, he had heartburn, what we
Okay.
call GERD, so that he slept every 2 hours. And I was the one, I ended up diagnosing it, and I took him to, I was an advocate. I Something is going on. This baby is not sleeping. He's wasting away. And so that is a little bit of a behind the scene to me stepping into Jasmine's Hollywood Hills place. So I wasn't going to go. You know, Britain was like, you know, you need to just get away. You know, you're actually just hoarding heart, you know, and I wasn't going to go. And actually, my husband was like, you know what, get out the house, go have a drink. You know, it seems like these women are like-minded, you know, to tell you about, you know, their experience and kind of build me up, you know, because I was feeling guilty. And so I was in that mindset, like, oh my God, like a relief, like, okay, I need to go, you know, Britain's telling me, like pulling me out the house, like, girl, you need to go meet these women. Everybody's a mother, you know? And so I get into a situation where I go to my closet. I look in my closet, and from that was the first moment I realized that my body's different.
Yeah.
Can't fit nothing that's in my closet.
Me during quarantine. But carry on.
And I was like, you know, once I mustered up the strength, like, you know, I need to go for my mental health. I need to hang out and get away from everybody. And I said, you know what, Kendra, just put on what you can fit and work, and you're going to go and you're going to have a good time. So I just want to tell you that, because I'm sure many, you know, what was, you know, other women's first experience when they left the baby.
Right.
From that point, I just went on walks with Heart to get that vitamin D, but I didn't go anywhere with anyone. And so, and maybe that was a little bit of postpartum where I was hoarding. I didn't let my mother watch him. My mother bogarted her in. But so that is my mindset, that I'm going and I'm going to have a good time and I'm going to get rejuvenated. I'm going to get my cup filled up so I can go back and take care of Heart and take care of Hobart and stop beating myself up that I can't figure out everything that Heart needs.
Right. And so you walk into that. And then it's like, welcome to reality TV. That, yeah.
Right. So I walk into a situation that, you know, that in all honesty, Kiki, no matter what I've been through or what I was doing, I have to be honest, that is the reaction I'm going to give to anybody, anyone, except my mother.
Okay.
So,
I understand.
You know what I mean?
I understand.
I think that I was just appalled because, you know, when you're looking forward to just hanging out with your girls, and at this time I really didn't know them, so I was like, you know what, I need to know some new girls, get my mind off my life. Hi, how are you? Who are you? You know, I'm a gynecologist, so talking about penises, talking about vaginas, you know, I also work in the hospital. I go to the ER because people got stuff stuck up their butt, you know. Like, I have heard it and I've seen it all. So it's not the conversation of, oh my goodness, your husband's Chinese. Is it true? Is that stereotype true? Does he have a small penis size? This, you know, I would be a damn lie if I told you that when we get together, we don't talk about good sex, bad sex, penis size, what your titties are doing, what your vagina is doing, you know, are your kegels divine? Like, so, but it's that the beginning process is when you kind of know someone. Do you see what I'm saying? So I don't know her, and then that was it. So I gave her a response that, like, I don't know you, and that, you know, no one in my world does that. You know, and I commend her. I commend Heavenly, because she immediately apologized. You know, a lot of stuff, you know, there's editing, you know, going on. Yeah. You know, and I'm the type of girl that I could give it and I can also take it. You know, so I admire her that she could take it. And she apologized. And what the cameras didn't see is her calling, texting, checking on me to make sure that I was okay. And to, you know, and I'm getting to know her. No one's perfect. You know, I don't hold grudges because no one's perfect. God knows that I've said things, but cameras weren't there. You see what I'm saying? And so I thought it was time for us to let everybody else know that, there's a mutual respect. I'm getting to know her, and what I know so far, is that she has a good heart. And
we love Heavenly. She's definitely one of a fan favorite on the franchise. She's definitely, Heavenly is a character for real, but we do love her.
in real life, that's her all the way.
Yes. Yes. And okay, last question about the show before we get into some health topics, because I definitely want to pick your brain about some things that girls, submitted questions. But there's a lot of talk about the franchise and the creators of the franchise, especially Mariah. And people are saying that she was fired from the franchise, but she's actually a creator. How do you feel being a member of the franchise and just knowing that a Black woman who is, says she's the creator of it is now being outed by the network?
Well, number one, if this is true, again, I've just been in the hospital. I haven't been up to date on, Mariah and what's going on with Bravo. But if that's true, this is unacceptable and something needs to be done. And we need to rally and support her, no matter if you like her or not, because right now it's her. Tomorrow it could be me.
Yes.
You know what I mean? So I believe that Bravo, I believe NBC, I believe that this could be resolved. I do. I am that person that, I love, just like I love America. I believe in this country, and I believe in this major network that is putting together positive shows, especially with Black people. We all fight, we bicker, yeah. But let's be quite honest. The reason why I joined it is because I'm thinking, Kendra, you're shy. You don't really like to tell people your business. But you know what? I didn't see doctors that look like me.
Absolutely. That's why
I mean, really? Like, wow.
Married to Medicine. Yes.
So I believe in the network, and I believe in the franchise, and I do believe that this can be resolved fairly.
Okay. Well, that's what we hope for. That's what the fans hope for. We do love Mariah. We feel like she's needed on the show. So hopefully they can make that right. But on to some health questions, because it's not I don't have doctor friends. Okay. You're my new doctor friend.
Girl. So, OBGYN.
Yes. So I just want to get to, some questions. Breastfeeding tips. I don't have children, but a lot of my friends who are new parents, they all, not all, but a lot of them have a lot of struggles with breastfeeding. People think it's just so easy, your baby will latch on. But what are some tips that you can give new moms?
Okay, here is a very important tip. And a lot of, I'll be honest, a lot of doctors, we support breastfeeding.
Yeah.
But visits, the way the healthcare system is set up, the time that they allot for us for our patients is very little. Okay, so that's why we depend on our lactation consultants. We depend on mommy groups, breastfeeding groups, because what I learned, breastfeeding is one of the hardest things that I have done, one of the hardest things I've done.
Yeah.
And what I have learned as a mother is that, new mom, is that it literally takes a village. And I mean this, Kiki. I wanted to give up at 3 weeks to stop breastfeeding, because it was just crumbs. Hart, he's a big boy. He needs it, and he wants it fast. And I was just giving, little amounts, and I really wanted to quit. And, I'm gonna have to give full credit to Hobart. He said, keep going. And the issue is, by the time you go to your postpartum appointment, that's 6 weeks, you've already given up. And so it was really by the 5th week where the milk just, with prayer, okay, the milk started just gushing out. And I thought to myself, wow, if I would have just gave up at that 3rd week, because, the nipples and the areolas, they have to get, like callous. They have to get hard.
Oh, wow.
So it hurts. So you have to push through that pain. Ooh. You got a new mom, and you got a baby that's never breastfed before.
Yeah.
Okay. And they're looking around, Hart's nosy. So, they yank, he's yanking, and literally, I had to push through pain, push through just not giving any milk for 3 weeks. And I had to humble myself. And Kendra Segura, Dr. Segura, had to go to a lactation consultant.
Wow.
And I was gonna cancel. And
Mm.
what I learned from that is that we need support, and we need to do better to support women who don't have, maybe a woman doesn't have a husband, doesn't have her mother. My mother is against breastfeeding. Maybe you're surrounded by a tribe of women who didn't breastfeed, and they want you to go back to work, and you don't need that. We got formula, So, so the lesson is that surround yourself with people that are like-minded, whatever goals you want to do in life. And if breastfeeding is one of them, find your mentors, find women who support you, and don't be disappointed if the person closest to you is like, whatever, right? My mommy was like Similac. She said, she was just saying that so many times. Like, Mommy, are you in partnership with them? Like, are they paying you? Like, what is going on? So I encourage every woman to just get you a tribe in a village, because it is not for the weak. And if you cannot breastfeed, that's okay too. That is okay too, because we do breastfeed shame women.
Yes.
Hospitals get paid for these initiatives to breastfeed. And so what happens is the opposite. It's, oh, you're not breastfeeding? Oh, well, you're not a good mother. So it's just finding people that are in line with your goals. That's it.
And that can support you.
Yes.
That's good stuff for the new moms that are watching. And I'm taking notes, but as Black women, we have all type of health issues that seem to affect us a lot more than other races and cultures. So I definitely wanted to get your thoughts on ovarian cancer, breast cancer, and what kind of preventive measures young Black women should be taking to help out with that.
This topic, I just don't want to cry right now, but this topic of prevention is near and dear to my heart. I recently, God bless her, I recently had a close friend who I went to her sister's, her sister passed. I went to her funeral, and she passed away, and she had cervical cancer. And I started thinking to myself, what can I do? What can I do to make sure that, healthcare professionals are taking care of patients correctly? Okay? What can I do to tell women to go get your preventive care stuff? Okay. Go get your mammograms for your boobies starting at age 40. Go get your pap smear starting at age 21. Okay. Ovarian cancer. It's interesting that you brought that up, because there's really no diagnostic measure. There's no way to prevent that. There's nothing we do yearly. There's no, we don't use ultrasounds yearly, but what we do use is how you feel. And since it's recently hit near and dear to my tribe, I'm thinking, and I have to do something more than just, going to work, coming home, and telling my patients. I need to get on, with you, Kiki, and tell everybody who is listening to this, to say, hey, everybody needs to go get their pap smear. Everybody, if your friends are 40, tell them, girl, happy birthday. But guess what? Your boobie is going to be smushed in that machine. Go do it. And I think as girlfriends, as your tribe, we need to remind each other, did you go get your physical? And one thing I want to say is that there's 2 physicals you should get per year. Okay. So I am the gynecologist. So I do bikini physicals.
Okay.
So the boobies, and I handle the vagina area, pelvic area.
Right.
But after you see me, you're not done. You then have to go see a primary care doctor, and you have to get a physical from them. And according to your age, they may check your cholesterol level. They may check you for diabetes. They might check your thyroid, depending on your age. And of course, they might tell you to go get a colonoscopy. I can tell you, but I can't manage you. So I just try to tell my patients, and we can spread the words. You too, Kiki.
Yes.
you need at least every 1-2 years, you have to go see both doctors, and it really should be yearly. Black women, we have, more comorbid conditions than most, as far as obesity, hypertension, diabetes. So I task everybody who's listening to make sure you and spread the word. Everybody else needs to see 2 doctors. Go love on an OBGYN and go find a primary care doctor that you feel comfortable telling all your business to, head to toe.
Yes. I think we need to also encourage the conversation more, because everybody gets like uncomfortable, when it comes to bodies and, health. And I think that we need more, interviews with Dr. Kendra, and more panels, and more, women on TV who can show us like, it's okay, relax. We all have one. But let's just make sure that we take care of it. So I thank you, Dr. Kendra, for your amazing tips today. And of course, your insight on the show. Is there anything you got coming up that we don't know about? I know we're in a pandemic right now, and you have a lot of work to do, but anything you want to let everybody know before we sign off?
Well, I'm letting everybody know that, I have I want to thank everybody. I have met, virtually like women that I don't even know.
Yeah.
Me encouraging messages. They tell me that it's okay to love on my body, and it's okay that I lose the weight slowly, because that's my thing now, because I have to worry about my health. I don't want to get diabetes.
Yeah.
In the midst of my projects going on is, revamping my diet, and I'm going to starting to work out. So I just want to say thank you. Like, women empowerment. Thank you for those pouring back into me. Definitely, I'll be in Atlanta very soon. I have some connections, some business stuff that you guys will hear soon about. And like I said, I want everybody to come with me on this health journey. I don't say weight loss journey. I say health journey, because I need to, mental health, my physical, and that work-life balance that, everybody is still trying to figure out.
It's so hard, but keep encouraging us, because I know that a lot of women get so busy taking care of everyone else that it's kind of hard sometimes for us to carve out time to make sure that we're taking care of us. So thank you for encouraging us, Dr. Kendra. Always feel free to hit me up with any tips you want to share with my audience out in Chicago. And we can't wait to watch you on our TV screens with Married to Medicine LA. So
okay. Thank you for having me.